Hi everyone, my name is Deborah Stoll, content producer for M&M's custom team, and it's my pleasure to welcome all of you to today's webcast, What AI Reveals About the Mental Health and Changing Needs of Healthcare Workers, sponsored by Culturintel. Many have reported that the impact of COVID on the overall health ecosystem. However, have we paused to understand that healthcare workers are also becoming patients impacted by unprecedented mental distress? Do we understand the deepest human needs and emotions which may be driving HCPs to quit and be part of the Great Resignation? Today's session uncovers the largest cultural intelligence analysis ever conducted to understand the mental state of the healthcare profession in the era of COVID. Our experts today include Lili Gil Valletta, Chief Executive Officer of CN Plus and Culturintel. A former marketing and corporate executive turned entrepreneur, Lili was at J&J for 10 years, where she was Global Director of Marketing Services and created the Hispanic Employee Resource Group, Hispanic Organization for Leadership and Achievement, and also pioneered the first ever multicultural marketing strategy for the pharma sector. Since then, she and her team, with offices across the US and globally, have impacted the strategies, inclusive marketing strategies, and growth of companies like Merck, GSK, Pfizer, United Health Group, CVS, and Google, among others. She has been recognized by PR Week as a top 50 most influential in healthcare, and in 2021's top 100 most influential Latinas, among others. You may even recognize her as she appears weekly on national television, an expert bringing data and a diverse perspective into today's business. We also have Dr. Sheri Prentiss, Chief Medical Officer and Public Health Lead at Culturintel. Dr. Sheri is a proven visionary, best-selling author, and highly sought-after physician leader. Since 2017, she has served as Chief Medical Officer and Public Health Lead at CN Plus, Culturintel, to bring both an inclusive and evidence-driven approach to promoting health equity and better outcomes. She is an occupational and environmental medicine physician, public health expert, certified speaking professional, and breast cancer survivor. She has served as national spokesperson for Susan G. Komen, as well as their national ambassador for health equity. She has also been featured in hundreds of television and radio interviews, reaching millions with her expertise in helping individuals unlock their potential, boost their self-esteem, set new directions, and prepare for lifelong achievements. Dr. Sheri is the founder of the Live Today Foundation, Inc., a 501c3 nonprofit organization meeting the needs of under-resourced cancer patients and survivors living with lymphedema. And we also have Dr. Ruby C. Castilla Puentes, Director of Clinical Research supporting Neuroscience Division of Johnson & Johnson Pharmaceutica, President of the American Society of Hispanic Psychiatry from 2020 to 2022, and leading medical strategies at OLA and Mental Health Diplomats, J&J Employee Resources Groups. Dr. Castilla Puentes was the director of the Psychiatric Department of a public university hospital, Santa Clara Hospital, focusing on the development of new treatment options for psychotic disorders. Founding member of the Columbian Colleges of Neuropsychopharmacology, and a longtime member of many associations, including the American Psychiatric Association and the American Medical Association. Dr. Castilla Puentes dedicated her career to addressing the health of the underserved, particularly racial and ethnic minority populations and patients with psychiatric conditions. And in August 2020, she published the book Quixotes of Psychiatry, which pays tribute to Hispanic psychiatrists who have contributed to the progress of mental health in the US and around the world. And without further ado, it is my pleasure to hand things over to Lili.
Thank you so much for the opportunity to be here together. And you will hear just a little bit from me because we really want to get the clinical, the practitioner, the provider perspective for those of you that are joining. As you heard it in the introduction, we know the obvious. COVID has changed everything. And just when we think we're getting over it, there is a new surprise, there is a new variant, there's new changes in the world. But as we all have been wrapping our heads around what this means, we wanted to honor those that have been caring for us through this pandemic that need care. And that is what today is all about. Hopefully, those of you that are joining come from diverse perspectives that can activate our resources, our focus, our priorities to serve those that serve us. And I am so excited to bring some data and perspectives as part of this, but we know that context has highlighted what we probably know intuitively is there, like the fact that the nursing workforce, is in stress and crumbling, as the CNN title suggests. The Great Resignation is also impacting healthcare in very big ways. But what does that mean in the voice of the people? And talking about the people, this is very interesting. Actually, I'm going to share with you all a clip from a news broadcast that actually aired about 2 weeks ago. I just caught it when I was in a hotel lobby, and it was so appropriate for this conversation today. So we pulled out a few minutes out of this full interview with a nurse practitioner. So let's play the tape so that we hear straight from the voice of those that we're going to talk about today, healthcare professionals. All right, so let's roll the video.
Let me ask you something. Do you have friends or family in the healthcare industry? And have you asked them how they're doing lately? They will most likely answer, nurses are not okay. Many nurses are left to silently suffer as they face overwhelming feelings of exhaustion, irritability, anxiety, and sadness. But for nurses, you say it's chipping away daily at our mental health. One recent study published in JAMA Psychiatric found that compared to the general female population, female nurses are at 2 times higher risk of death by suicide.
Mm-hmm. It's a really hard topic to talk about. And that first question, right, how are you doing, I think can open up a lot of this conversation. We do have data coming out, and those statistics with the research team led out of University of Michigan predated the pandemic. So we don't really know how much the pandemic has actually exacerbated mental health conditions and deaths by suicide. Just recently, actually, on Friday, a team that I'm on out of New York University published a study that looked at the first 6 months and looked at nurses' psychosocial health. And over a study of over 600 nurses, there were really high rates of depressive symptoms, high rates of anxiety and insomnia, all those that chip away, like I wrote, at our mental health and ultimately impact the quality of care that we're able to deliver to patients. In healthcare, there are things that we can focus on to strengthen what we call our work environment, where we work. And there are initiatives, like you said, that can actually move the needle and best support and protect our nurses. And we ask that you keep advocating for us, hearing our voices, and helping us so that we can better protect and serve our patients, because that's what we want to do.
There you have it. Like I said, that was just a short clip of what was almost an 8-minute conversation about this topic. Now, as you heard, there's very little clinical data or case data right now that really suggests that at scale, what is it that is happening to the social, behavioral, economic, and psychological impact of healthcare professionals. However, today, and this is why we're so excited to share it and democratize it with the world, we have access to tap into the voices of 49 million digital discussions and comments of healthcare professionals that for the last 12 months, 18 months, have been volunteering how they feel in the anonymity and the strength that the World Wide Web represents. So beyond social media, Facebook or Twitter, there are blogs, there are news sites, there are topical sites, there are forums where professionals actually share with each other advice, concerns, and comments. And this is arguably one of the largest sources of data and intelligence that we can tap into to get a quantitative analysis of the qualitative data that 49 million voices represent. And that is what we're sharing with you today. What is it that those voices reveal? Now, many of you, because of course we're in a medical media type of audience may be questioning, gee, how does this methodology work? Is it actually a valid and scientific method that I can trust? Well, rest assured, the way this methodology works has been published in multiple medical journals. In fact, we have Dr. Castilla right here, who has published in partnership with the Cleveland Clinic a couple of times, leveraging the digital voices of people and patients to be able to understand drivers and barriers to treatment and the mindset that may be impacting people's everyday life. So let me show you what this method, just to set the record straight with the methodology, how it works. And if I could just move to the next slide, if somebody could help me go to the next. There are 3 stages to how this works. We harvest and scrape everywhere there is an open digital discussion happening, not interfering with any privacy, not going behind any firewall. Everything that is open in a comment box gets harvested and then organized and clustered to look at the patterns, because the way people speak and the context and the tonality of those discussions gives us, if you would imagine, bubbles of intensity of how big is the conversation, what is the thematic around that, which gives us clues into the topics that are, aggravating a certain sentiment, whether positive or negative. And then we're able to report this back. Also, I want you all to know ahead of time, there is a website as well as an infographic that is available to all of you to access. So if we don't go into the specific findings of every single data point and what we revealed out of the 49 million discussions, you can always access this as a follow-up from today's discussion. Now, let's look at the next slide real quick too, because a lot of people are skeptic sometimes with the sources. The 48 million digital discussions are not coming from social media. As you see here, the sources are quite diverse. Topical sites, which are probably very specific forums or sites about health or healthcare or jobs in healthcare, is really where we're seeing the greatest share of these discussions. And then as you see on the bottom left-hand side, we have segmented those voices through the lens of physicians, nurses, HCP support personnel, and EMTs, because we tend to just blanket healthcare professionals as one big label. As we all know, there's different roles in that whole process of delivering care, and we wanted to acknowledge what that sounds like and what are those factors impacting differently the different roles. Now, here's some headlines. If we go to the next slide, one particular big aha is the fact that physicians in particular are 1.8 times more angry or experience more anger than the overall population as it relates to their personal relationship and impact of COVID in their lives and mental well-being. Anger is a very strong feeling, so put a pin on that. Now, in the way we analyze it, as we look at the next slide, we get to look at the quotes. What does this sound like in human, talk? And they're saying we're exhausted, not only from the pandemic, but coping day to day. So there's definitely that stress and having to keep it together, right? And definitely the burnout and the depression is coming to the forefront in a lot of the verbatims and millions of comments that we have seen. Now, I'm going to show you 2 slides, and then we're going to talk to the experts here, our practitioners, clinicians, psychiatry, published researchers that we have with us. But this next slide just gives you a picture, a quick overview of how the sentiment profile is quite negative. Maybe you're not surprised by this, but you can see that there are some differences as it relates to the nurses versus their peers in the HCP community. Actually, physicians are a bit more optimistic. But here's the very interesting slide. If we look at the next one, it's not just about sentiment, positive, negative, neutral. Because how can you find even positive comments around everything that's happened with COVID? But this is where you actually get to the psychology or the psychographic profile of what is it that these professionals are saying that is being impacted the most. And then there is their behavioral health, how they carry through life every day. That is that lighter blue part of the chart that definitely takes a higher share of those factors that they organically, unsolicited, when nobody's asking them a question, are expressing in comments. But as you can see here, the psychological impact, it's a bit greater for nurses compared to some of the other professionals. And then there is also some social impact that carries through quite consistently across the different groups. I told you there's a lot more data, and I am inviting you, and I'll close with this, to go to the site that we have democratized and open to the world to see and access. If you look at the next slide, you can jot down that actual URL. We'll make sure to put it in the chat. But in there are Power BI dashboards that you can actually access. You have infographics you can click and download so that you can go deeper into the fact that, yes, 1 in 3 healthcare workers is battling with depression. At least they're saying that in their comments. 73% of them feel negative overall as it relates to the impact on their well-being, especially mental well-being. And we're hearing anxiety, loss, and depression as the biggest challenges that are the reoccurring themes on these millions of digital discussions that we're hearing from the HCPs. So definitely there's a lot of room for impact. I can throw these numbers, maybe you can intuitively assume this is what's happening, but then so what? What does this mean to the individual? And I'm going to start with Dr. Sheri. As you're looking at these numbers and we're hearing the anger, the depression, the anxiety, the burnout altogether, what does this burnout, how does it impact the actual work environment, right? So twofold question here. And also, how does this impact the way providers and hospital systems, deal with this new reality for their own workforce? So what's your take on that, Dr. Sheri?
Thank you for asking, Lily, because this is near and dear to my heart as a physician. When Culturintel looked at and took this deep dive, one of the quotes that physicians shared was that this is a physical quote. There is this now internal conflict between protecting yourself, but also having to go out there and save lives. My fear is getting sick and not being there for my family. This is a complete shift from the way that we used to think. It became a part of who we were to go out there and save lives, and secondary to think about our families. And so what the Great Resignation has done for healthcare professionals is that they're now begun to question their work and life priorities. And the work or the lack of the work-life balance is driving this sense of desperation, with many of them reporting PTSD as a result of the pandemic. And so what is also shifted for us is that we're now sharing and talking with each other. We used to just go to work. We did what we had to do to take care of patients. But now there is more discussion amongst fellow healthcare professionals, and they have begun to question the trade-offs that they make with their employment and the quality of life. And so they've begun to reevaluate a career that was once one of sacrifice, compassion, and altruism. And they're now leaving in search of what they call, and these are in their words, more meaningful and less stressful positions, and ones that will give them a higher personal satisfaction. I mean, whoever would have thought that we would have gotten to a place where we now no longer see providing care and saving lives as more meaningful, or one that would not give us more personal satisfaction. So what has become clear and evident is that now healthcare professionals are now evaluating putting self-care needs and mental health ahead of a job and a career path. And this is a trend that the healthcare sector has never experienced. And unfortunately, with this burnout, what is happening is there is now increased workloads on the remaining staff. And the remaining staff, they're already themselves burned out, and they're looking for their nearest exit. But what these staff shortages can do is that they can affect the quality of patient care, create safety concerns for both patients and staffs. And the exodus of more experienced staff members leaves a gap in the supervision, the education, and instruction of the more novice members. And we can't overlook the financial impact on hospitals and healthcare systems. I'm telling you, the short and long term threats of understaffing have led several systems to go deep into their pockets. And now, in an effort to keep workers, hospitals and health systems across the country are paying $24 billion more per year for qualified clinical care than they did pre-pandemic. And let me reiterate that qualified does not equate with experience, and neither should one assume that the word qualify is synonymous with quality. And so our healthcare systems, they have responded, right? We're trying to come up with ways of retention and retaining and recruiting other healthcare professionals in light of and in preparation of a more extraneous mass exodus, but they can't keep up with the numbers that are leaving, with replacing them with the bodies of even new novice individuals. And what I can tell you, and I'll take a pause after sharing this, is that from an emotional intelligence standpoint, a fundamental error that systems have committed is to say, you're a hero. You can do it. You are amazing, right? They give them plaques and they give them recognition and they buy them pizza and they stop there believing that these tactics will be enough. But acknowledging healthcare professionals as heroes without supporting their needs devalues the price that they pay every day to stay in the trenches. So giving them a gold star like we received when we were in kindergarten will not support retention, and neither will it provide the mental health support our HCPs desperately need.
Wow, that is so profound. And by the way, this conversation is being recorded. I think there is a quotable remark right there from Dr. Sheri. Gold stars like in kindergarten are not enough, or bringing pizza, or even clapping, right? Like we used to do in New York. The streets will burst, and that feels emotional and it's beautiful. However, is it sustainable and really addressing the unmet needs of those that serve us? And I think a lot of it also may have to do with a misunderstanding of the gravity of this. And I want to go to Dr. Ruby about this, because Ruby, you are a psychiatry expert. You are looking at the leading treatments and therapies in this space. You're a published researcher. And could it be that we are not understanding the difference between burnout and depression? What is it, and how do we identify it, especially for this healthcare community?
Thank you, Lili, for this great question. I think that coming from a family of physicians is really important. It's very close to my heart to be able to identify it. And as you mentioned, I have been working for many years around these topics about burnout, depression, suicidality in physicians. And it's very important to distinguish the two conditions that you mentioned, burnout and depression. When we are talking about burnout, we are talking about the results of a chronic work-related stress, and has a specific characteristic, has an emotional exhaustion, low sense of personal accomplishment, detachment from patients, for example, if this occur in physicians, mental and healthcare professionals. Burnout can occur in any occupation, but has been found, most studies of physicians, to be as high as 50%. Burnout is different, a different phenomenon from other well-understood mental health disturbances such as depression or anxiety disorders. While burnout typically only occurs in the setting of chronic war-related stress, depressive and anxiety disorders may arise in the absence of any external stressors. So the distinction of symptoms can be difficult to identify, while diagnoses such as major depressive disorder have a very clear criteria in the DSM-5 and the Diagnosis and Statistical Manual. The definition of burnout has varied over the years. Based on the most definition, burnout may carry overlapping with symptoms with depression, such as loss of enjoyment from work or an increased feeling of fatigue, that they are really key symptoms also from in the depressed patients. And further confounding the disorder is increasing severity of burnout has been strongly associated with an increased likelihood of major depression and suicidal thoughts. As burnout is a risk factor for other mental conditions, understand symptoms and warning signs might facilitate prevention and earlier physician intervention before mental health problems develop.
That is fascinating, and thank you for clarifying that. And now, if we know, obviously, besides just the HCP community, depression is obviously a public health concern. We have seen the numbers now, what's happening with young people and the impact of isolation and lockdowns and things of that nature. But, you know, our HCPs have to still go and show up and do what they're meant to do. So how can, you know, how can systems and hospitals, and this is a question for both of you, Ruby and Dr. Sheri, what then needs to be done differently, right? I'm sure burnout was there, and long hours and stressful factors when you're a physician or a healthcare professional, but this is different. So what do we do that is different? Because different times are calling for different interventions. Maybe, Ruby, we can start with you. Is there anything here for the audience that's watching that can probably influence policy, budgets, and resources? What do we do?
Very good question, Lili. And I think that we can have some recommendations at the local level and also at the in general and in the global level. So we can put in perspective on a local level, having more conversation within teams, focus on the emotional aspects of a case, of a patient, or even the day, can more normalize feelings and mental health in medicine and make useful verbalization more in the commonplace. So if we bring to the normal life those conversations about the feelings, about how the physicians are feeling about one case, about the death, about thoughts, that they have, probably we can normalize this conversation, and the physicians might make efforts to speak about their mental health. We open the conversation when we normalize this, when we talk about the issue. Our medical profession must recalibrate the normal to create a safe environment for all physicians, starting with leadership level on down the medical hierarchy. There are also efforts to change the language of physician, the license questions that is really something that of reduce, or they are barriers for physicians to seek mental health care. In a medical or surgical culture where poor mental health is normalized, physicians often do not know how to identify it when they get help for themselves or their peers. So using assessments tools that they are available, we can support, or we can have more evidence, concrete evidence about the problem, the symptoms, and increase the likelihood of the physician to seek the support that they need. We have some examples of available tools in the internet, but we need to be sure that the physicians, like other human beings, are able to get access to those self-awareness instruments and to be able to talk about these mental health issues.
That's amazing. I love, let me just repeat, I was kind of typing what you were saying, Dr. Ruby. Useful verbalization. And that as a mechanism to normalize the dialogue, open the conversation. Now, that in itself, it's a culture shift. Dr. Sheri, I'm curious what your take is on that. Is it now the time to take the cape off and talk about the kryptonite? What do we do? Like, yes, open the conversation, but is there structures, the way management or the way even compensation or hours are built in your schedule that you may talk a lot about it and maybe even normalize it, but what else does it need to happen in the everyday? Any thoughts, any tips on that?
Oh, absolutely. Absolutely. And let me start by saying I loved Ruby's definition when she was describing burnout, because when you listen to it, you hear that our healthcare professionals, I and her included, are at we're in an emotional war. We're at a place where we are so mentally and emotionally drained. We are having the experiences of being at war. And when we went to work, physicians and nurses, we didn't complain. We didn't talk to one another. We just got into the trenches and did what we needed to do. So yes, this is the time for us to verbalize what we are experiencing and shout loud and shout often. But that is a new mindset for us. And many of the mature physicians who came up before me or back in the day, I mean, I can't believe I'm at 30 years of practice nearly. That's a new trend for us. Now, maybe with the millennials and new generation, they've been more trained to get into the trenches with emotional intelligence and sharing your feelings and emotions. But that's not typically something we've done. It was a profession of being stoic, and you went in and did what you had to do. But I can tell you that many of the healthcare systems and hospitals, one of the things that they could start by doing is making what they're offering made known to their employees, because many employees don't know when their employer is actually providing benefit offerings that directly address burnout, like, employee assistance programs or digital mental health tools. They're present, but they don't necessarily make employees aware or do better at making them aware that these resources are available. And so most employers could be doing more to raise awareness of these offerings. And what will happen is that it will improve the wellness of their workforce, and it'll cause them to receive the maximum return out on their benefit investment. But there will still need to be a focus on reducing burnout. There needs to be positive organizational cultures, and health systems and hospitals need to work at improving a sense of feeling valued, rather than merely slapping on a title of heroes, because it has been shown that feeling value was strongly linked to lower odds of a physician or a nurse reducing their hours or even leaving. And so organizations that implement strategies to enhance healthcare workers' sense of value, establishing nurturing environments, and decreasing work overload through better teamwork, that really aims at limiting stress and averting turnover, those hospitals and institutions will fare better. You have to have a deliberate strategy. Employees have to feel a sense of purpose. There needs to be focus on professional growth, and healthcare workers should be allowed to have input into decisions in the workplace, PPP, EAP, eligibility for, COVID-19 illness for themselves or for family members. And healthcare systems need to show that they're not afraid of elevating their current employees to positions of the C-suite. Stop looking outward, look inward with the talent that you already have. Cultivate that talent, grow that talent, retain that talent.
That is amazing because, might as well look at any industry. We know the Great Resignation is impacting everybody. There is also added pressures on diversity, equity, and inclusion, and cultural shifts that have called every employer, for that matter, to rethink policies. But I think what's really interesting here, Dr. Sheri, I'll say it again. You talked about a nurturing environment where value is not just, given the gold star or even monetary value, but it's the fact that I see you, I hear you, and therefore let's make decisions together and also invest in your professional growth. And that is a different kind of invitation to be part of the solution than just being, one piece of the puzzle that somebody else is managing on the chessboard. So this is great. And I do want to actually acknowledge the fact that our data, and again, it's our website, will have it all available. There's Power BI dashboards. We even have it by key states. So we have the US as well as California, Florida, New York, Texas, because the experiences are different. But we saw overwhelmingly, even at the state and national levels, that nurses in particular were the ones that were more negative, were the ones expressing a more traumatized feeling towards the impact of COVID in their own personal lives. And they're also acknowledging and flagging the fact that they do not have mental wellness, that they're lacking it. Nurses in particular. I want to double click on nurses. What is it that could be uniquely different? Or what is it that, as we look also into interventions, we should acknowledge or double click on as it relates to interventions, mechanisms, and the impact on nurses as they struggle? So, Dr. Ruby, anything that you can think of as it relates to tips for maybe even communicating or helping them, or what about nurses is it that you may think is exacerbating their experience with mental health?
Very good question, Lili, because we are the healthcare professionals. We are all on the same boat, and this happened long before of the COVID-19 pandemic. The physicians, the healthcare professionals, they were significant worse compared with the peers, age-matched peers with high rates for burnout, depression, and among the highest suicide rates of any profession. So they were impacted before. Like burnout, psychiatric comorbidity is high prevalent among the healthcare professionals, among physicians, among nurses. The prevalence, to give an example, the prevalence of depression or depressive symptoms have been estimated to be 30%, approximately 30% among resident physicians and 25% among medical students, in any school of medicine. They are less data for attending physicians, for nurses, but this pattern exists, and this is not limited to depression. Also, healthcare professionals also are likely to be more, to have more anxiety disorder, PTSD, traumatic events, medical training, and also this is applicable on not only physicians, but nurses and other healthcare professionals intrinsically correlates with during the training they can develop higher rates of suicidality compared with the age-matched peers. When you compare the peers, medical students and also healthcare professional students, they have more risk, higher rates of suicidality when they compare with other peers. So while the baseline mental health in the healthcare professional was already poor, the stressors of the COVID-19, they are really aggravating this. in the frontline workers, for example, to provide an example, in New York City, the high rates of psychological symptoms of distress, including acute stress. More than 50% of the healthcare professionals reported that. Depressive symptoms, 50%. Anxiety symptoms, 33%. So they are really high numbers. And the issue is that they don't. One of five healthcare workers reported needed service and not receiving them. So they are really a disconnection, between what they have and what they receive. And it's important for healthcare workers, especially physicians, nurses, to recognize their own mental needs and know when they require help. Also, it's important for them to know how to help their peers, how to recognize their mental problems and seek care.
That is so good. 1 in 5 reporting that they needed the service but not receiving it. Now, there could be a whole line of reasons of why. However, that irony, right, of those that are the experts in healthcare treatments and well-being it's not matching up their need with the treatment or therapy they themselves may need to care for themselves. There's something there to reconcile. And, I am in this conversation, the business gal, right? The former pharma marketer. And I always believe that those of us, especially maybe some of you that are watching, those of us that have the power and responsibility to influence budgets, to influence resources, to influence campaigns. One that is near to our hearts, Ruby, me as a former J&Jer, is, for example, the campaign for nursing that J&J has committed to for so many years. So there is power in content and marketing and resources directed the proper way. But it's time to kind of rethink where those monies go. And I do want to be a bit business focused for a moment here. And I'm going to kind of pass it to you, Dr. Sheri, as I elaborate on my hypotheses here.
Yes.
Is it time that those of us that have the responsibility of leading the way marketing budgets or pharma resources are directed to influence and educate the HCP, that we rethink how we utilize those resources, or what is it that we're doing for engaging HCPs? Because typically, and I'm going to keep it real here, when we think about our engagement of HCPs, is so that we can empower them with the clinical data and the evidence they need so that they can support this therapy and treatment that I'm putting in front of them as a viable solution for their patients. But this sounds different. It probably needs to be utilized differently. How should we be using our resources, our money, our influence as industry leaders in marketing and communications and patient education to support what we're hearing here in this dialogue? Dr. Sheri, loaded question, but there's budgets out there and there's an interest to influence the HCPs. Do we need to change the marketing playbook?
We better.
What do you think?
We better. If the industry and hospital and health systems do not change their thought pattern to view their physicians and their other healthcare professionals as valuable human capital that needs to be nurtured, grown, attended to, we're going to lose out. Too many times physicians have been looked at, you go through med school, you pay all this money, you did all this training, there's a certain invincibility that's around them, but this is a human being. And you are so right, Lili. A lot has been placed. A lot of money's been spent on EMRs. A lot of money has been spent on creating the flow chart to make it real easy so that the physician can meet his or her RVUs and see as many patients as they possibly can in the next hour. But if you do not put the resources and the money into building that individual, retaining that individual, and making sure that that patient and that Because I'm sorry, I was right. That was not a Freudian slip. Your physician and your nurses in this day and age right now are your patients as well. And so if you don't treat the patient that is treating the patients, your system will not survive. The community will not be fed. Your name and the excellent health grades that you've been receiving, you will not maintain, because now your healthcare professionals have become patients in need of care. So why not do the right thing? Be proactive. Let's get ahead. I mean, we're a little behind it. We're a little reactive, right? Because we didn't think about this beforehand. But we can be a little bit proactive before it gets too bad and provide the healthcare professionals with the attention and the care. And that may be medical care, that may be building, that may be training, there may be extended EAP services, whatever it may be. If you do not invest in your HCP human capital, you can forget trying to meet your goals. Forget about your 360s. They're going to be bad. Forget about your performance improvement plans. They're going to be bad. Whatever you put in place will fail, because the people that you are expecting to bring in your downstream revenue are falling apart. They are committing suicide. They are leaving and going to work for Lyft and Uber. What are you going to do? So now is the time. And individuals who have the ability to make a change, I encourage you to be the leader in this space. You be the leader in this space and allow other individuals to tap into what you're doing. And you can now be seen as the proactive solution. And now you'll be the place that you can recruit and retain the HCPs that you need in order to provide the service to the communities that you serve when you made that commitment to the community.
Oh my goodness. I couldn't think of a better way to close our dialogue. We want to give some time to people's questions and comments. That was incredible. I feel like there's these quotes we need to put up in like a social media post somewhere, Dr. Sheri. If you don't take care of the patients taking care of your patients, we will fail. That is just, again, a different perspective. And I do want to give Dr. Ruby a final word as well. Ruby, imagine that you have every influential decision maker from the AHA, the American Hospital Association, in front of you, that you have maybe every payer and pharma CEO in front of you. Based on what we know, some of this information, your clinical experience, what would you tell them that they should do in the next 12 months? Magic wand, boom, you have them, captive audience. What should we do?
Question. It's a great question, Lili. I would like that they think about the patients, not only the physicians, the impact to have physicians or healthcare professionals, that they have the pressure and how impact in the outcomes of the patients. So I would like that they think in general, not only in the well-being of the physician and healthcare professionals, that they can make errors that mean more, more frustrated. They can express more frustration in front of patients. They have less motivated to take care of the patients. They can be easily exasperated with patients, that they are all the impact of depression in the healthcare professionals. But I would like not only to think in the healthcare professional, I would like to think in general in the impact of these, the mental health issues in the patients as well, in the society as well. So if I have in front of me these people that they have all the money, the influence, I would like to encourage them to pay more attention to mental health in general, to create campaigns where we can identify easily the mental health issues. It's easy to talk about diabetes, hypertension, other conditions, but it's very hard to talk about depression. And it's in general. It's not only for healthcare professionals, it's in general. So I would love to have more campaigns about the importance of mental health in the communities, in the healthcare professionals, but also in general.
Love it. So with that, I do want to thank you both, of course, for your passion, your expertise, your commitment to this space. We at Culturintel feel like the megaphone of the 49 million digital discussions, comments, and voices that we have curated in a report, like I said, that you can all access. We are putting this out as our gift to the world so we can enlighten with some more insights. There were some great tips because I want to leave us not just feeling heavy with this topic. A lot of practical things you both shared. The useful verbalization and normalizing a conversation and those forums in the workplace are critical. Also leveraging HCP assessments and tools that can give us not only mechanisms to evaluate your own self, but more evidence in this space. I heard loud and clear what Dr. Sheri said about feeling valued. And valued is much more than free pizza and clapping at 6 p.m. It's about engaging the voices of these professionals as part of the decisions the administration are making, maybe policies, maybe compensation services, and also a commitment to professional growth. And also, Ruby, you talked about maybe this needs to really work its way upstream to medical training. How is this changing? You know, we know that medical schools and in the last 2 years, a lot of emphasis has been put on health equity, social determinants of health, a lot of new factors that are being baked into the way we assess patients, educate students. Well, is there an opportunity to reimagine how medical training integrates this conversation, right? And last but not least, I will restate Dr. Sheri's quote. If you don't take care of the patients, taking care of the other patients you want to impact for better outcomes, we will fail. So this is a patient-centric discussion. The twist is that based on the data, the evidence, and even some of the state of health before COVID amongst our own physician community, the patients in this case are those that are also caring for the patients themselves. Mm-hmm. So lots of room. Thank you for your wisdom. And I do want to honor the audience, maybe with a few minutes for questions or comments that have come up in the chat. And I want to be just so grateful for your attention. And MM&M for always bringing leading conversations and information forward for our industry to become better and to make better decisions that really impact more lives. So with that, I will pass it on to maybe Deborah. You're going to close us off and go from there. Thank you.
I'll hop in. Thank you so much for that incredible conversation. That was really, really impactful. I do have a question here that I would love to open up to the group. How can people not directly involved with the healthcare system help?
Dr. Sheri or Dr. Ruby?
I guess I'll jump in.
Okay, go ahead. I was jumping in. It's different.
If you're not part of the healthcare landscape, one, just taking a step back and viewing that individual as an individual. Take off the titles. You know, we think about the president of the United States and think, oh, they have it all. They're making all these decisions. At the end of the day, he's just a man. And so if you're not involved in the healthcare space, but you have the ability, you have a for-profit or a not-for-profit, you have the ability to pour into this collective of individuals, take a step back and view, one, they are people. They're going through life is happening to them just like it's happening to me. And in addition to that, I'm putting the care of myself and or my family and or neighbor into their hands. And so what can I do? Ask them, how are you doing? Is there anything I can help with? If you are an organization and you have resources, create a resources that pours into this community of individuals and helps to grow them, help meet that mental health need, help them to counter all of this negative space that they have been feeding with trying to keep up with all of their goals, all of the patients, all of the billing, the pandemic, their own life, their children, a lost child, somebody's on drugs, things are happening. And so view that individual as you would like to be viewed. And then follow the leading of your heart. Yeah, empathy.
That's it.
Dr. Shri,
Empathy.
this is
Ruby, any thoughts on that?
Yes, I would like to add that it is really the fundamental piece is start the conversations about mental health. Start the conversation about asking if they are fine. It's okay to talk about mental health naturally. They're bringing up to your own experience during the conversation, and normalize this conversation, discuss the topic further. This is something that is a pandemic, and it's hard for all of us. We can start the conversation like that, without any judgment. Be direct, talk about mental health, talk about without accusing anyone or making feel like they are doing wrong things. They let them know that you are really worried about them, about the people, So I think that this is important. And like Dr. Tree, I think that you provide all the excellent input about this. So just a minor addition to what you already said.
That's great. Anything else? Any other comments from our moderators?
We do have time for one more question. And there's a really, there are tons of questions coming in. So here's, excuse me. This is an extension of the first question. What role can a pharmaceutical company play? Is there something that a medical affairs department could do?
Oh, I love that one. I will answer as a pharma marketer, and then pass it on to our clinicians and experts in the panel here. I think that just as much as we have invested, whether it is in medical affairs, or even in patient education, right? Remember, HCPs in this case are patients too. It's the same rigor that we put into understanding what is the unmet need and the insight, and what resource do we want to deploy to help our patients, or what kind of upskilling or new evidence or information do you want to bring to the medical community. This, what we've learned, highlights the fact that any of you in the pharma space that are working in neuroscience, mental health, in that therapeutic area must take responsibility and accountability for dialing up the resources and knowledge that we're deploying to the HCPs that we serve. Not just for them to serve patients, but for them to self-evaluate and serve themselves. So I think it's a shift in paradigm of medical affairs departments, not just equipping with knowledge for HCPs to serve others, but to also serve themselves in the process. Now, from a marketing standpoint, and I think Dr. Ruby just said it not too long ago, as much emphasis as we have out there, November turns pink everywhere because it's Breast Cancer Awareness Month, right? Or we have diabetes this and heart disease that, and the Go Red campaign and fashion shows where everybody wears red. Where is an equal or as exciting effort or investment around mental well-being? And specifically in this case, for the heroes that we have turned into heroes, but are quite vulnerable, as we have learned in this discussion. So there is room for pharma to redirect that same budget that is already educating, engaging, and creating forums to expand the conversation to be inclusive of what this condition or therapeutic area means for the practice itself. And that is where we have some gaps to fill. Anyway, that is my soapbox, but I think we could do a lot. And no pressure, companies like yours, where you work, Dr. Ruby Jansen, very committed to mental health. You are here, you're publishing a lot, and I'm sure your commercial folks can do a lot more too. So hopefully this inspires more people to do it.
Absolutely, Lili. And I think that you mentioned education is the key, and investment in education about mental health.
I think we have 1 minute,
hop
Deborah. The top.
Sorry, there's a bit of a lag. Was there, did you want to wrap up on that question? Dr. Sheri, was there anything you wanted to add?
Sure. Real quick, when I hire based on mindset because skills I can teach. And so I would recommend to pharma, okay, invest in the mindset of the individuals that are in play, that are taking care of the individuals for which you are creating resources to help extend and improve their lives. So invest in the mindset.
Mm-hmm. Mm-hmm. Oh, I
Awesome.
love that, Deborah. Before I lose my thought, because this is important, sales reps in many cases are a frontline relationship builder with the practices, right? Whether it's the front office or the doctor himself or just the staff. I think we need to reimagine the role of our field sales professionals. Yes, they bring evidence and data and breakthrough, therapies and information that makes the practices better. But I think more than sales agents, they can become empathy agents as well, and a gateway to relationships that maybe take a whole different context, knowing that in many cases they may be that first line of relationship and connection to like the pharma entities or labels. So I think there is a lot of room. No pressure for those of you in the field sales organizations, but for you to rethink the role you play as human connectors and empathy builders as well.
I love that term, empathy agents. It's like a new superhero.
Mm-hmm.
I'm very sorry to say that is all the time we have for today. On behalf of MMM, I want to sincerely thank Culturintel for today's webcast. Also, a big sincere thank you to all of our speakers, Lili, Dr. Sheri, and Dr. Castilla Prentiss for sharing their insights and their thoughts and their empathies. And of course, to all of you out there, our audience, for tuning in and participating. Today's webcast will be available on demand on the MMM site under the events/webcast tab for up to 1 year. So you can revisit it. You can tell others who didn't get to make it today where to find it. And that is it for us. Once again, thank you so much to everyone. We hope you're staying safe, and we'll see you soon.